Hi students and interns, we're now going to be looking at RxPharmacist specific writing guidelines. And I want to shift our attention to writing effective test questions because this is a very integral part of our program. The NAPLEX and MPJE use specific question formats, and the most common question formats that you will find on examinations are multiple response and K-type. The questions written for the NAPLEX and MPJE are based on competency statements for the MPJE and content outlines for the NAPLEX, which is effective May 1st, 2025, and is divided into domains. And this, of course, is to test the student's knowledge of certain topics. So continuing on with writing effective test questions. For the first example, we have a multiple choice question, and it reads, over-the-counter acetaminophen must have which warning on the label? If we read through these very quickly, we can see that B and E share a similarity. They both deal with the liver. One with liver toxicity and one with liver dysfunction. If someone were to write a question like this based on these answer choices, of course it becomes ambiguous. So how do we fix that? On this next example, for the multiple choice question, it is the same question, but now the difference is striking. The E answer choice now has a clarified answer choice of foul taste, which diverts its shift off of liver toxicity, which is different. It's not the same thing anymore. So now B becomes the obvious choice and correct answer. Questions should be written based on a certain level of difficulty, which can be categorized into lower order thinking questions, mid-order thinking questions, and higher order thinking questions. Questions can be thought of as being structured using Bloom's taxonomy, which is a hierarchical methodology of the learning process. And most test questions will be based on low and mid-order thinking questions, and the higher order thinking questions will require time management strategies, as these have multiple layers and complexities to them. Basically, you have to know these questions like the back of your hand. Here is an example of a diagram of Bloom's taxonomy, with the lower being remembering and understanding, the mid-order being applying and analyzing, and the higher order thinking questions being evaluating and creating. So let's put that all into perspective. Here is an example of a lower order thinking question. Based on our experience of the top 300 drugs, we know that the generic name of Celexa is going to be citalopram. That's a lower order thinking question would just require simple basic recall. Now this one's a tough one. This one's a higher order thinking question, which has lots of layers, lots of complexities to it, lots of parts to be taken apart and put back together. So let's read this. LT is a 48-year-old female who is visiting her psychiatrist to discuss treatment options for her depression. After trialing 2 antidepressants, LT is still experiencing residual symptoms of depression. LT is currently taking 200 milligrams of sertraline daily, 10 milligrams of lisinopril daily, and 20 milligrams of rosuvastatin daily. What recommendation should be considered to mitigate LT's depressive symptoms at this time? Now, just looking at all this, it does require a great skill of psychopharmacology. So let's take a look at the answer choices. Answer choice A says to increase sertraline to 300 milligrams daily. We know that from the package insert, sertraline can only go up to 200 milligrams daily. Of course, off-label will have higher. Answer choice C says to initiate isocarboxazid and stop sertraline. Now, isocarboxazid is not typically a depression medication that you would give for these residual symptoms of treatment-resistant depression. And neither is D with amitriptyline. And of course, if you look at these two answer choices, there is some kind of risk of serotonin syndrome along with them. And E, to initiate diazepam, that would be an incorrect answer because it is not a treatment for treatment-resistant depression. So all you're left with is initiating esketamine. The patient is already taking sertraline daily, so this qualifies her for this medication.